So I'm going to teach you how to diagnose and treat C2 through C7 in about 16 minutes. So let's jump in. So in this video, we're only going to focus on your typical cervical bones, and that's C2 through C7. The first rule is that C2 through C7 are side bent and rotated in the same directions. So if I tell you that C4 is side bent to the left, and I ask you the rotation, you would say that C4 is also rotated to the left because it's the same direction as the side bending. So if I give you another one and I say C7 is rotated to the right, you automatically know, because it's the same direction, that C7 is also side bent to the right because it's the same direction. Here is, if I do that, here's C1. Now if you notice C2 right here, it is a lot longer because C2, 3, 4, 5, 6, 7, they all have spinous processes. C1 doesn't. It does look a little pointy, but it doesn't have a spinous process. So this pointy thing is called the posterior tubercle. Here we go. So here's your occiput. You're going to slide off of your partner's occiput until you feel a little divot. Now you can't go this far into feeling that posterior tubercle. So you're just going to slide off and be like, it's soft, I don't feel bone. And then you're going to keep going inferior until you feel the first bone, which is a spinous process of C2. Again, because C1 doesn't have a spinous process, it doesn't stick out far enough for you to feel it, and you're not able to palpate deep enough to feel the posterior tubercle. So that's how you find C2. A few other things that's probably review is that when you diagnose the body, you're always diagnosing its freedom, or what the person's body likes to do. So if I naturally like to side bend to the right, you're going to have that in your diagnosis. You're going to diagnose me as being side bent to the right. But if we're doing muscle energy, which is a treatment, and is muscle energy direct or indirect? Go ahead and pause it, and I'm going to say it. It's a direct treatment, which means that you put them into their barrier. And I always think of that because if you're a direct person, like you're willing to just hurt people's feelings to get to the truth, like literally you'd be willing to be like, you have a booger in your nose. Versus an indirect person might be like, oh, you might want to look in the mirror, you know? Like with a direct person, you don't mind like hurting their feelings. Same with a direct treatment. You don't mind taking them out of what's comfortable for them and putting them into their barrier. So if I'm naturally side bent and rotated to the right, with muscle energy, you're gonna take me where I don't wanna go. So I like to go to the right, so you're gonna swing me over to the left in the side bend and rotation. So that's muscle energy. You need to know that too. There's two different ways to diagnose typical cervicals. You can do it with the side bending, also known as the translation method, or you can do the rotation method. So I'm going to show you the translational or side bending method first, and you can figure out which one you like better. Although it is good to know both, just because if you're not sure on one, you can double check yourself with the other. Okay, so side bending method, also known as the translational method, which is where you find the articular pillars. So I have a vertebra here, cervical vertebra, and I want you to follow along. So pretend like here's a person laying straight up, which means they're laying on their back, so the spinous process is down. And so here's just one cervical bone that I'm pushing on. So I find a cervical bone, and I find the spinous process, and I'm gonna just follow the bone outward until I feel a drop off. When I feel a drop off, this is what I'm gonna push on. Here's your articular pillar with your superior and inferior articular facet. And so I'm gonna put my fingers on these, and I'm just gonna push them to the left and push them to the right and see which one moves better. If they move symmetrically, there's probably not a dysfunction there. Another thing to note is if your partner tells you you're hurting them, most likely you're on the transverse process. You're a little bit too far forward. So yeah, your partner will definitely tell you that because that's uncomfortable. So make sure you're on the articular pillars, a little further back, and you're gonna push to the left, push to the right, and that's also known as translating. So you're translating to the left, translating to the right with your fingers. And let's say that I translate to the left and they move really well, and I can't push them to the right very well. So they like to translate to the left, which means they're side bent to the right. So let's explain this. I want you to put your hands on your hips, and I want you to try to push your hips to the left. So whether you're standing up, sitting, push your hips to the left. Notice how when I pushed my hips to the left, my hips sticking out further that way, but my body leaned this way. So I was able to translate my hips to the left, but I side bent to the right. So it's always opposite. So one way you can think of it is I push to the left, I can't really push to the right, so they like being translated to the left, which means that they're side bent to the right. Another way Dr. Weston likes to look at it is, okay, they like to be translated to the left, and I can't push them to the right, which means they're side bent to the right. So he likes to think whatever they don't like to do, whatever direction they don't like to go, is the way they're side bent. So I can't push them to the right, so they're side bent to the right. I like to think of it as, oh, I can push them really well to the left, so they must be side bent the opposite. Let's say that we know that they're side bent to the right. It's a typical cervical, which means I'm working on C2, 3, 4, 5, 6, 7, one of those. If I know that they're side bent to the right, what are they rotated? Are they rotated to the left or to the right? I'm going to say it, so pause it if you didn't already think about it. They are rotated to the right as well because it's a typical cervical. So remember, it's easy, it's typical, so it's side bent and rotated in the same direction. If I said that it was side bent to the left, you would say that it's also rotated to the left. Second and final method for diagnosing typical cervicals, which would again be C2 through C7, would be the rotational method. So instead of the side bending or translational method where you're pushing it to the left, pushing it to the right, we're going to do rotation to see how they're side bent. So here's my cervical vertebra again. Pretend like the patient is laying upward, like here's their face facing the ceiling, and here's one of their cervicals. So instead of going all the way out here, you find the spinous process and you go out until you feel that drop off, and then that's where you're going to push to the left or to the right. Instead of going out there, you're going to find the spinous process and you're just going to go, it's pretty midline, honestly. You're really close to the spinous process because you're not out here. Instead, you're just going to be behind it so you can push upward. And so what you're going to do is look at my thumbs. That's where you're going to be pushing. So my thumbs, I'm going to push my thumb up. So if the patient's laying down, I'm literally pushing my thumb towards the ceiling. So that's how I get rotation because they're laying down. So I'm pushing my thumb towards the ceiling because they're laying down, and I'm just seeing, okay, looks like they like to rotate to the left. Do they like to rotate to the right? If they do, then that means there's no dysfunction. It's symmetric movement. So, and again, here's like the patient's right side. Here's me pushing up on it. By pushing that forward, it makes them rotate to the left. I hope that makes sense. Here's my thumbs on the articular processes, but the posterior part of them. And I'm going to push up towards the ceiling, push up towards the ceiling, and I'm going to see which way they like to rotate. So let's say I push up this way. So this is my right thumb, and this is also the patient's right side because they're laying down. So I push up towards the ceiling, and they like to rotate to the left. I'm going to push up towards the ceiling, and they don't really like to rotate to the right. So we diagnose the body for what it likes to do. So they like to rotate to the left, so they're rotated to the left. Now this is a typical cervical. If they're rotated to the left, what are they side bent to? Side bent to the left. So now let's go through treatment now that you know how to diagnose your typical cervicals. And we're going to use muscle energy again, which is a direct treatment. You're going to place them into their barrier where they don't want to go. So it's the opposite of your diagnosis. So let's go through an example. So we're going to do translational or side bending example first, and then I'll do a rotational one. So we found the spinous process. We go out until we feel a drop off, and this is where we start to push on the sides of the articular pillars. So now that you have that, you can follow along, do this in the air if you want with me. So we're going to push to the left or translate to the left, and we're going to push to the right. And let's say they translate really well to the right, but I can't really push them to the left very well. So I can push to the right very well. So if they move to the right, they're side bent to the left. So another way to think of it, like Dr. Weston says, is I can't push them to the left, so they must be side bent to the left. So either way, we know, let's say this is C4. C4 is side bent to the left, so it's also rotated to the left. So side bent and rotated to the left for C4. But now we have to figure out, is it flexed or is it extended? So, and this is of course the same for either rotational or side bending method. But this is where, if you're at like C2, when you nod their head forward, it's only going to be a little bit. You don't have to do it a whole bunch. Versus if you're at C7, you're going to have to flex further to get motion down at that level. So I hope that makes sense. You would be holding onto their head, and then you'd have your C4 I usually use my middle fingers, but like whatever's comfortable for you. So I use my middle fingers and I'm translating. We already said that it moves better to the right, so it's side bent to the left and rotated to the left. Now we need to know, is it flexed or extended? So we're going to nod forward and let's say it moves better. So it moves better in flexion and I try to extend and it is worse. So that means because they got better in flexion, what's their diagnosis? Pause the video and tell me. And I'm gonna say it. So C4 is flexed, it's side bent to the left and rotated to the left. So now we have to figure out how to treat that. So muscle energy, we're gonna put them in their barrier where they don't wanna go. So it's the total opposite of the diagnosis. We're gonna put them in the barrier, we're going to extend them. And I'm going to be feeling C4 while I extend them because I wanna feel that motion. I don't wanna go past it. So we're going to extend them. I have C4 between my middle fingers or whatever fingers feel comfortable for you to use. And I extend them. Now remember, your patient is side bent and rotated to the left. So we have to do the opposite. So we extend them, we're going to side bend and rotate them to the right. And then what we have them do is, I wouldn't go on the temple because it's usually pretty sensitive, especially for people who have headaches. But sometimes I'll use like the cheek or something and I'll let them know like I'm putting my hand there in case they, I don't know, don't like it or something. Or I'll put it maybe on the jaw and I'll tell them, try to rotate to the left. So the opposite direction I put them in. Because instead of saying like, can you flex and rotate and side bend this way? Like just have them focus on one. And so you're going to have them rotate to the left and you're going to resist them. You'd have them do that for 1, 2, 3, 4, 5, relax. I'm gonna further extend, further side bend to the right, further rotate to the right, and I'd have them do it again. Okay, can you rotate back to the left while I resist? 1, 2, 3, 4, 5, relax. We're going to further extend, side bend, and rotate to the right because we're bringing them further into that barrier, and then we'd have them do it again. So can you rotate to the left? And I'm resisting so they can't move. 1, 2, 3, 4, 5, relax. And then we're gonna do a passive stretch in extension, side bending, and rotation. So it's kind of like a swing all in one. And then you put them back to neutral. I should note that technically, instead of asking the patient to rotate the opposite way, you could say side bend the opposite way. For me, I feel like it's just easier for patients to understand, hey, can you turn to the left? Instead of being like, can you side bend? Like, I don't know. That's my opinion. Okay, last example, we're using the rotation method and then we're done with this lab. So again, we're going to rotate, focus on my thumbs. I'm only holding up here so it doesn't fall. So we are going to just feel, first of all, you feel the spinous process, you go out, not that far out like you do with the translational method because you're not gonna push to the sides, you're just going behind the facets here. So you're going to feel, is anything posterior, first of all, because sometimes people are just naturally maybe like this and you're like, wait a minute, this one's a little bit more posterior feeling than this one. So they're naturally rotated this way. So this is the left side, so they're naturally rotated to the left. Or if you don't feel that, might not be as obvious, you can push upward towards the ceiling because remember, your patient's laying down. I usually do this with my middle fingers, but I'm showing you with my thumbs so I can have it close to the camera. So push up towards the ceiling, push up towards the ceiling. Which one moves better? So if it moves better, we'll say rotating this way. So here's the patient's right side. I push up towards the ceiling and it moves really well, but this side doesn't. So the side that moves really well, I know that they're rotated to the right, or sorry, rotated to the left. There we go. They're rotated to the left versus this left side, when I push up, it doesn't really want to rotate. So they're rotated to the left. Again, let's say we're at C4. So C4 is rotated to the left. If I know that they're side bent to the left. Good. So now we need to know if they're rotated and side bent to the left, does it get better in flexion or extension? We're going to be on the articular pillars. We're gonna nod forward into flexion, and I'm going to push up towards the ceiling and feel if it gets better when I rotate it, or if I extend it and it gets better. But let's say I extend it and it gets better, and in flexion it got worse. So now we need to name it. So extension made it better, so C4 is extended, and we already said that when I push up on the right side this way, it's easier to do that, which means it was rotated to the left and side bent left. So again, C4 is extended, it's rotated and side bent to the left because it's a typical cervical. So now we're gonna do muscle energy. We're going to take our patient here, and remember they were diagnosed as being in extension, side bent, and rotated to the left. So muscle energy is kind of mean, put them in their barrier. So we're doing the opposite of what they like. They liked extension, so they get flexion. Again, you're monitoring with your fingers just until you feel it. So you're going to flex until you feel movement. And then they liked the left side, so you're going to side bend them to the right side. And you're going to rotate them to the right side. And then you'll let them move the way they like to go. So they like to go to the left, so I'd tell my patient, okay, turn your head to the left. And they would try to turn it while I resist for 1, 2, 3, 4, 5, relax. I'm going to further flex, further side bend to the right, further rotate to the right. If you guys remember, it probably sounds really similar from your thoracic diagnoses and treatments. So I put them further into the barrier, and then I had them turn to the left for 1, 2, 3, 4, 5 while I resist, and then they relax. We're going to further flex, further side bend, further rotate, and I'm going to have them, there's like a fuzz floating around. I'm going to have them turn to the left again for 1, 2, 3, 4, 5, relax. And I was resisting that whole time. And then we're going to do a passive stretch. And then, of course, just like you do after every treatment, you reassess.